Welcome to the King County Library System in Western Washington, or KCLS. The library system is made up of 49 locations residing in the cities surrounding Seattle. Our research aimed to discover whether communication barriers exist between library staff and patrons with disabilities, and what training is needed for KCLS staff members, if any, in order to provide more equitable services to patrons with disabilities. When we started working on our research, we initially wanted to include surveys of patrons with disabilities because there's a large gap in the literature here. It seems logical that one needs to question the end user to determine whether a service is satisfactory. However, getting this perspective is not particularly easy to get when researching. Surveying patrons with disabilities would have required access to a group with many members of that demographic or finding candidates by observing the libraries. Librarians are easy to locate and identify and are inclined to assist other librarians and future librarians. Due to time constraints, we were only able to survey the latter. Our research had two aims. The first was to find the different services that are available for patrons with disabilities within KCLS, and the second was to look at the potential barriers that may hinder or complicate services for patrons with disabilities, such as miscommunications with library staff members and physical inaccessibility within the libraries. We collected data through both interviews and questionnaires. When creating our instruments, we first individually composed interview questions based around staff experiences and opinions and KCLS trainings, and then consolidated our individual work into a single 10-question interview script and a single 10-question questionnaire. The interview script focused on experiences, services available, required trainings, and improvements that could be made at KCLS libraries to increase equitable service to patrons with disabilities. The questionnaire, which used a combination of fixed response, scaled, and open-ended questions, focused on interactions between staff and patrons with disabilities, as well as identifying the different services and media formats that are available for patrons with disabilities. We also asked staff members to rate their confidence levels when providing services for patrons with disabilities, and we asked what training was currently available to them and what further training was still desired. We collected data at 6 different branches within KCLS. For the interviews, we selected library management staff and librarians because they have worked within the library system longer than other types of staff, and they are aware of more of the accommodations requested at the library. For our questionnaires, we selected library public service assistants and librarian assistants because they are at the forefront of the libraries and have most of the initial interactions with patrons. We had 6 respondents for our interviews and 10 respondents for our questionnaires. Each interview lasted approximately 30 to 45 minutes, and each questionnaire took anywhere from 20 to 30 minutes to complete. In the interviews, we began by asking our respondents if they had any experiences with patrons with disabilities. When asked this question, the majority of our respondents mentioned that patrons with mental disabilities are the most challenging to communicate with, though mental disabilities are the most common type of disability that they see at the libraries. When speaking to patrons with mental disabilities, they often found it difficult to get the point across in an accessible manner, which could hinder the patron's ability to get the most out of their library visit. We also wanted to know what respondents believed were the most welcoming and unwelcoming parts about the libraries for patrons with disabilities. Welcoming aspects they identified included ADA accessible computers, spaces that can be comfortably navigated by a patron in a wheelchair, and accessible parking spaces for patrons near the front entrance of every library. One unwelcoming aspect mentioned was the fact that there is usually only one ADA accessible computer per library, and it is sometimes blocked by patrons without disabilities who needed to use a computer. Additionally, at some high-volume library locations, it can be difficult for patrons who need extra time to communicate their request to the staff because the staff has less time to focus on individual patrons. Also, not very many staff know American Sign Language, making communication with patrons who are deaf or hard of hearing more difficult. Available services for patrons with disabilities identified by the respondents included 2 lending accommodations. One is a program which allows patrons with disabilities to have an extended loan period on library materials, preventing late fines that would be caused by travel and health-related complications. The other is a program that allows patrons with disabilities to waive the requirement of coming to the library and showing their photo ID and proof of address in order to obtain access to the library materials. Other kinds of accommodations can also be requested. Respondents also brought up the Library to Go program, a service that allows patrons to check out library books from a library van. The van usually goes to child care centers, low-income housing, and senior centers each week. A service of the Library to Go program, Words on Wheels, was specifically created for patrons with disabilities who are unable to visit the physical libraries. Many other services exist as well. However, during the course of our interviews, we found that staff members see the need for additions and changes to the KCLS libraries in order to be more accessible for patrons with disabilities. Available trainings mentioned included one that provided a basic guide to appropriate language to use when talking to and about people with disabilities, one called Mental Health 101 that's a discussion-based training about the different types of mental states and disabilities along with useful communication phrases, and one called Intellectual Freedom about providing open and equal access to all patrons no matter their gender, beliefs, ethnicity, or disability status. Lastly, we asked respondents to design new ways of making the library more accessible for patrons with disabilities. Some ideas were providing adjustable desks for patrons with disabilities, lowering the height of book fixtures, including ADA accessible software on all computers, and providing ADA accessible furniture. Staff members were unsure as to whether these changes would be feasible and whether they would be supported by the libraries due to financial and space constraints. At the beginning of the questionnaires, we asked the respondents the following question. When you hear the word disability, what comes to mind? Responses included autism, ADHD, anxiety, vision loss, hearing loss, chronic illnesses, Parkinson's disease, and physical disabilities that require wheelchairs, walkers, or crutches. 2 respondents provided conceptual answers rather than specific conditions, and one explained how they believe the term differently abled is a more positive term to use than disability. 80% of staff members who completed the questionnaire interacted with patrons with disabilities at least multiple times per week. All of our respondents stated that they have provided assistance unrelated to disability accommodations to patrons with disabilities. 70% have also engaged in social exchanges with patrons with disabilities, and 30% have provided assistance related to disability accommodations. When reading their confidence about providing assistance related to disability, accessibility, or accommodations, 10% of respondents reported feeling very confident in helping patrons with disabilities, and 40% responded feeling somewhat confident. This meant that only half of our respondents felt at least somewhat confident when helping patrons with disabilities. The other 50% felt either neutral in their confidence level or somewhat unconfident. However, 80% of respondents reported that they felt that they had done a good job handling situations involving people with disabilities at least most of the time. When asked about KCLS programs that are specifically designed for patrons with disabilities, 70% of respondents were unaware of whether there were any programs available at their library. Another 20% reported that there were fewer than 2 programs available annually, and 10% of respondents said that there were no programs designed specifically for patrons with disabilities at their library. All participants were able to identify multiple accessible media formats available at their library, so while specific programs for patrons with disabilities are widely unavailable or not well known, library materials themselves are much more accessible. The most common challenges respondents reported facing when interacting with people with disabilities were misunderstanding the patron and being misunderstood by the patron. 2 respondents discussed this specifically in relation to deaf patrons, but others stated the same concept more generally. 3 of the respondents were also challenged by balancing the needs of a patron with disabilities and the needs of other patrons. Respondents expressed an interest in training to improve their ability to serve patrons with disabilities. Topics of greatest interest include mental health issues, general communication with patrons with disabilities, and using accessible technology. 2 respondents would also like to learn ASL. Other ideas for improving interactions between library staff and patrons with disabilities included increasing programs and collections specifically designed for people with disabilities, getting to know patrons and sharing that information with other staff, and creating a platform for patrons with disabilities to tell libraries what would be helpful to them. Overall, it was clear that library staff wanted the libraries to be welcoming to patrons with disabilities. Seeing how little-known programs for patrons with disabilities were among respondents, in addition to not knowing the perspectives of patrons with disabilities who would be utilizing these services, make it less clear how effective current methods of creating a welcoming environment for patrons with disabilities actually are. Further research ideas that could make this clearer include researching more KCLS branches, identifying a full list of programs and services available for patrons with disabilities, and surveying patrons with disabilities to find out their awareness of these programs and what other programs they would find useful. Thanks so much for watching!